I have completed the following NLN Nurse Educator competencies as follows. Number 1, facilitate learning. I have developed a program for middle school children on the risk of type 2 diabetes and ways to help reduce risk. The development of the EKG simulation program also facilitates learning. Number 2, facilitate learner development and socialization. I've learned strategies for teaching that can be tailored to students' needs. Number 3, use assessment and evaluation strategies. I wrote a paper on the process of performing clinical needs assessment. This involved looking for a need, then performing a literature search to document the problem, and a needs assessment to determine the need. In addition, I was taught how to consider and find potential funding sources for any potential program. Another project involved a PowerPoint presentation where I looked at the accreditation process and performed an in-depth review of a local nursing program. I learned about strategies for assessment and evaluation. Number 4, participate in curriculum design and evaluation of program outcomes. I attended a curriculum evaluation meeting where NCLEX scores were discussed with suggestions for change to improve scores. I have also developed the EKG simulation program that is currently being refined before it's presented to the students to determine if the program can facilitate learning. Number 5, function change, agent, and leader. Collaboration with my preceptor helped me develop an EKG simulation. This was a change in the way EKG education is presented and will be studied to determine if the simulation program enhances knowledge of reading EKGs. Number 6, pursue continuous quality improvement in the nurse educator role. I participated in a discussion forum with my peers to discuss a well-known model for continual process improvement is the plan, do, check, act cycle. The forum discussed how to use this model and to improve student teaching, pursuing continuous quality education. Number 7, engage in scholarship. I have read multiple articles on education in nursing. With new evidence-based practice is published, one must evaluate the evidence in the article and determine if it's sufficient to make changes in care. Changes can be made through nursing committees and introduced to the staff through information meetings. Number 8, I worked with my preceptor to understand the nurse educator role. This included attending curriculum committee, performing an interview on student advising, and presenting a project to the IRB. And my teaching and learning philosophy. As a teacher, I believe that one should look at the learning as a lifelong process. To be an effective teacher, one must keep up to date on changes in practice and medical knowledge. This is especially important in the rapidly changing world of nursing. My aspirations and goals are to transmit information so that students can learn to master concepts and skills, develop critical thinking, and learn to become competent in essential skills for nurses. To achieve these goals and objectives, I will use the active learning. This will include case studies, simulation, active lecturing, and team projects. To assess student learning, I would use tests, papers, and interactive projects. It's important to see each student individually, considering their culture and learning styles. Students may have some medical experience, but they are not nurses, and as an instructor, it's important to remember that each skill may be new and may take time to be mastered. I believe that nursing students encounter more stress than students in other disciplines, and understanding how this stress affects learning is important. I believe that it is important to evaluate my teaching so that changes can be made to achieve program goals. This can be done with student and peer evaluation. To be the best teacher possible, I believe that continuing education is essential.